Many people believe diabetes can only be discovered through a blood test. You visit your doctor, get lab work done, and that's when you learn something is wrong. I understand why people think that because many of my patients believe the same thing. My name is Dr. Michael Bennett, and I practice medicine for more than 20 years. One thing I've learned is that the body often gives warning signs long before blood tests reveal a problem, and one of the first places those signs appear is in the feet. I made this video because I've seen far too many people arrive at my office, or even the emergency room, after ignoring symptoms for months or years simply because they didn't know what they meant. Recently, I saw a 67-year-old retired man who felt perfectly healthy. Before ordering blood work, I asked about his feet. He mentioned they had been numb for a while, but he assumed it was just aging. He already had 4 of the 9 signs we'll discuss today. His fasting blood sugar came back at 214. He had diabetes and had likely been living with it for over 2 years without realizing it. Today, I'll show you 9 warning signs that many people miss. For each one, I'll explain what people often assume it is, what's really happening inside the body, and one simple habit that may help. According to the American Diabetes Association, 1 in 5 Americans with diabetes doesn't know they have it. That's millions of people living with a condition that quietly damages nerves, kidneys, eyesight, and feet. The good news is that diabetes can often be detected early, but first, you need to know what to look for. Sign number 1, tingling or numbness. Almost everyone has experienced pins and needles in their feet, and most people dismiss it. Patients often tell me, "My foot just fell asleep because I crossed my legs." That can happen occasionally, but when numbness or tingling happens regularly without an obvious cause, it's worth paying attention to. Frequent tingling, known as peripheral neuropathy, is one of the earliest signs of prolonged high blood sugar. Excess sugar slowly damages a protective covering around nose, causing signals between the brain and the feet to become distorted. That distortion creates the tingling sensation. According to the American Diabetes Association, nearly half of people with diabetes develop peripheral neuropathy, and it usually begins in the feet. That's why this symptom should never be ignored. One habit I recommend to every patient over 60 is a daily 20 to 30-minute walk. Regular movement improves circulation and helps protect the nerves. And start cutting back on added sugar today, not next month. Today. Sign number 2, burning feet at night. Many patients tell me their feet feel like they are burning when they lie down at night. They often blame it on standing too long, fatigue, or hot weather. Sometimes they are right, but persistent burning sensations, especially at night, are a classic sign of diabetic nerve damage. High blood sugar can damage nerves and cause them to send incorrect signals to the brain. Your brain interprets those signals as heat even though nothing hot is touching your feet. The burning sensation is coming from irritated nerve tissue. Research published in Diabetes Care found that burning foot pain is often one of the earliest symptoms reported by people later diagnosed with type 2 diabetes, sometimes years before diagnosis. 2 habits can help. First, drink plenty of water throughout the day to support kidney and nerve health. Second, increase your intake of fiber-rich foods such as vegetables, beans, and oats. Fiber helps slow the absorption of sugar into the bloodstream. Sign number 3, wounds that heal slowly. This sign is more than uncomfortable. It can become dangerous. Many patients tell me they had a blister or small cut that simply wouldn't heal. They expected it to close on its own, but weeks later, it was still there. High blood sugar damages small blood vessels and reduces circulation. As a result, oxygen, nutrients, and infection-fighting cells can't reach the injured area efficiently. A small wound remains open, creating an opportunity for infection. According to the CDC, diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. Most of these serious problems begin with a minor wound that was ignored. Make it a habit to inspect your feet every day, especially after bathing. Look between the toes and around the heels. If you notice a cut, blister, or broken skin, clean it carefully, apply an antiseptic, and cover it. If it doesn't improve within 48 hours, contact your doctor. Don't wait. Sign number 4, changes in skin color. This sign is often hiding in plain sight, yet most people never connect it to blood sugar. Patients sometimes tell me their feet or ankles have become darker, reddish, or even slightly bluish. They usually assume it's aging or normal skin changes. But poor circulation caused by high blood sugar can reduce the amount of oxygen-rich blood reaching the feet and lower legs. As a result, the skin may begin changing color. In some cases, the skin also becomes thinner and more fragile, another sign that the tissue isn't receiving enough nourishment. I often remind patients that the feet are the farthest part of the body from the heart. When blood vessels become damaged, these areas are among the first to show signs of reduced circulation. Research published in the Journal of the American Academy of Dermatology found that these skin changes may appear many months before diabetes is formally diagnosed. A simple habit that helps is spending 5 minutes each morning doing ankle circles, calf stretches, and toe raises. Even small amounts of movement can improve circulation. Elevating your feet while sitting may also help. Sign number 5, severe dryness and cracked heels. This sign surprises many people because they assume it's simply dry skin. Patients often tell me, "My heels crack every winter. I've always had dry feet." And while dry skin is common, persistent cracking that doesn't improve with moisturizers may point to something deeper. Diabetes can damage the autonomic nerves that control sweating and moisture in the skin. When that happens, the feet lose their natural ability to stay hydrated. These cracks aren't just cosmetic. They can become entry points of bacteria and infection, especially when circulation is poor. I've treated patients whose heel crack became so severe they bled, despite years of using lotions. The American Podiatric Medical Association recognizes chronic heel cracking as a possible sign of autonomic neuropathy, a condition linked to long-term elevated blood sugar. One of the best habits you can develop is moisturizing your feet every night. A quality lotion or pure coconut oil works well. Apply it to the heels and soles, but avoid putting moisturizer between the toes because excess moisture can encourage fungal infections. Also, stay hydrated throughout the day. Healthy skin depends on moisture from both the inside and the outside. We've covered 5 warning signs so far, and I want to ask you something. Have you noticed any of these symptoms in yourself or someone you love, a spouse, parent, sibling, or friend? If the answer is yes, don't ignore it. These signs don't necessarily mean you have diabetes, but they are worth discussing with your doctor. Early detection can make an enormous difference and may help prevent serious complications later on. All right, let's continue. Sign number 6, swollen feet and ankles. Many people assume swollen feet are simply the result of sitting too long or spending the day on their feet. Mild swelling can be normal, but if your feet and ankles are consistently swollen and your socks leave deep marks by evening, it's worth paying attention. High blood sugar can damage the kidneys, which play a major role in regulating fluid balance. When kidney function begins to decline, excess fluid can collect in the feet and ankles, causing a condition known as edema. According to the National Kidney Foundation, diabetic kidney disease affects about 1 in 3 adults with diabetes, and swelling in the lower extremities is often one of the earliest visible signs. One simple habit is to elevate your feet whenever you rest. Even placing them on a pillow can help reduce fluid buildup. Limiting sodium intake is also important because too much salt causes the body to retain water. And if swelling is new, persistent, or worsening, bring it to your doctor's attention. Sign number 7, sharp or stabbing foot pain. This is one of the most commonly misunderstood symptoms. Many people assume the pain comes from arthritis, aging, or an old injury. Some even rely on pain relievers for months without addressing the underlying cause. But diabetic nerve damage doesn't always cause numbness. Sometimes damaged nerves become overactive, sending abnormal signals to the brain. Patients often describe the sensation as stabbing pain, electric shocks, or a burning needle, especially at night. The pain is real, but the problem isn't an injury, it's the nerves themselves. Research published in the New England Journal of Medicine found that painful diabetic neuropathy affects about 1/4 of people with diabetes and is frequently mistaken for arthritis or age-related pain. A helpful habit is to spend a few minutes stretching your feet and ankles each morning before getting out of bed. Gentle foot massages before bedtime may also improve circulation and help reduce discomfort. Sign number 8, constantly cold feet. Many people joke about always having cold feet, especially during winter. But feet that stay cold all year long, even under blankets or during the summer, can signal poor circulation. When blood vessels become narrowed by years of elevated blood sugar, warm blood has difficulty reaching the feet. As a result, the feet remain cold even when the rest of the body feels comfortable. The American Heart Association reports that peripheral artery disease affects millions of Americans, and diabetes is one of the strongest risk factors. Cold feet are among its most common early symptoms. One of the best things you can do is walk every day. A brisk 30-minute walk helps improve circulation, strengthens blood vessels, and supports overall health. If 30 minutes feels overwhelming, start with 10 minutes and gradually increase your time. The important thing is to start. Sign number 9, hair loss on the feet and lower legs. This is one of the least discussed warning signs, and many people never notice it. During foot exams, I sometimes see little or no hair on the top of the feet or lower legs. Patients are often surprised because they never paid attention to it. Hair follicles depend on a healthy supply of blood and oxygen. When circulation is impaired by years of elevated blood sugar, the follicles gradually stop receiving the nutrients they need, and hair growth begins to disappear. This can be an important sign of blood vessel damage. Research published in Diabetes, Obesity, and Metabolism found a strong connection between hair loss on the lower extremities and peripheral vascular disease in people with diabetes. Take a moment to look at your lower legs and feet. If the hair in those areas is noticeably thinner or absent compared with the rest of your legs, talk with your doctor and consider having your blood sugar checked. A simple test can provide valuable information and may help detect problems early. We've covered 9 warning signs that could appear long before a person receives a diagnosis of diabetes. These signs don't necessarily mean you have diabetes, but they should never be ignored. One of the hardest parts of my job is meeting patients who have experienced several of these symptoms for years without understanding what their bodies were trying to tell them. They cared about their health. They simply didn't have the information. Now you do. Tonight, take 30 seconds to examine your feet. Look at the skin, check between the toes, and pay attention to any numbness, wounds, swelling, discoloration, or other unusual changes. That simple habit could help you recognize a problem before it becomes serious. And if you notice anything we discussed today, don't panic, but don't ignore it either. Contact your doctor and have a conversation. In many cases, diabetes can be successfully managed through early detection, healthier eating, regular exercise, and proper medical care. You've worked hard for your health and independence. Don't allow something as manageable as elevated blood sugar to take those things away simply because you didn't recognize the warning signs. If you found this information helpful, share it with someone you care about. A family member, a friend, or a neighbor may benefit from hearing these signs as well. And if you'd like more conversations like this, I post a new video every week covering important health topics for adults over 60, topics I discuss with my patients every day but that many people never hear outside a doctor's office. I'm Dr. Michael Bennett. Stay informed, stay proactive, and take good care of your feet. I'll see you next time.